Today we're going to talk about vaginal woes, how to treat bacterial vaginosis.
Is the most prevalent vaginal infection in the U.S. and it affects 29% of women ages 14 to 49. And so our group, we decided to research complementary alternative treatments to treat bacterial vaginosis. For non-pregnant females of reproductive age diagnosed with bacterial vaginosis, does the use of complementary alternative medicine treatments alone or as an adjunct to antibiotic treatment reduce BV recurrence?
So that's your PICO question.
Yeah.
I'm nurse practitioner Artesia, and what brings you in today?
Hi. So I've been having some itching and pain down here.
Mm-hmm.
There's a bit of a strong smell, and there's some extra discharge that I'm used to.
Okay.
So I don't know. I had something last year. They treated it, and it feels like it's back. I don't really know. I want to get some medication for it.
Okay. Do you think you may be pregnant?
I don't know.
Okay, so we'll get a urine exam, and how about you scooch on down and let's take a look.
Okay.
Woo, girl. I think we have BV.
Oh, yeah?
Yeah. There's a foul odor, kind of fishy. There's a discharge. When I tested your pH, we're at about a 5.1. And by the way, are you having any pain during sex or urination?
I am.
Great. You definitely have bacterial vaginosis.
Okay. So what can I do to treat the bacterial vaginosis? I had it last year. I have it again. Like, what's the deal?
Right, Lydia. So you did have Flagyl last year. You tried that, right?
Yeah, that was the antibiotic that I went on.
So, BV does have a high reoccurrence rate. So you can either go back on Flagyl or you can explore the other 3 antibiotics. But most of them do have a 7-day course. And within that course, you can't have any sex. Or, you know what? You can't use condoms. Do you have any problems with that?
Yeah, my partner and I use condoms when we have sex, so that's an issue.
Well, I think you should stay away from sex completely for the entire course. Okay. What about alcohol?
I mean, I do drink a little bit, yeah.
Can you stay away from that as well?
I could try.
Because I really need you to finish the entire treatment.
Okay.
Okay?
Yeah, I remember that from last year.
Do you have any questions?
Well, I guess I'm just worried because I've heard that antibiotics wipe out like all the good bacteria both in your gut and your vagina, and I've been taking so many. Like I had a tooth infection earlier in the year, so I took them. I had this BV last year.
So yes, there are other alternatives. There's our complementary alternative medicine treatments, and in conjunction with treatment with the antibiotic we talked about, you can take probiotics, and what that does is replenishes the good bacteria in your vaginal cavity and also in your gut. But if you absolutely do not want to take any of those antibiotics, there's other alternatives as well, but I really feel like this is the perfect therapy for you.
Okay.
It's probiotics.
I'll take the probiotics and antibiotics. Can you prescribe both of those to me?
Sure. Okay. So my medical assistant will have your sheet, and you can go to any pharmacy that will take it.
Thank you.
No problem.
So in conclusion, we realized through research that the recurrence rate is really high. It's like 50% recurrence rate in the first 12 months. And that recurrence rate has been explained by the inability for antibiotics to fully eradicate the biofilm in the vagina, as well as there's a compliance issue. It's hard if you are limited in sex, no alcohol for 7 days. You're not going to have a really high compliance. Also, by the antibiotics further deplete the good bacteria, the lactobacillus in your vagina. So that kind of exacerbates the problem. So that's why we wanted to look at alternative approaches, and there's some really promising research out there.
Yeah, so one of the things that, as you saw in our example, was probiotics, specifically lactobacillus, as a way to either support or an alternative to antibiotics. And what it can do, it actually is effective. They found in research of eradicating the biofilm. That has been an issue that doesn't happen with antibiotics. And it can also help replenish and rebuild the good bacteria in the gut, in the vagina, to kind of help with the reoccurrence. So that was really exciting. In Up to Date, currently, probiotics are talked about as neither go for it in practice or don't go for it. They're saying that there's a lot of research that still needs to be done. They need to follow through on some bigger studies to make it part of standard practice, but it is promising, and it is listed in up to date currently. We also found some other things. There were smaller studies that were done as alternatives to antibiotics. Calendula was one of them, vitamin C was another one, and garlic was another one. Those were smaller studies that we found. We did include that in our research, but currently none of those are being recommended in practice. And then that's pretty much it. We have one pro tip that we wanted to talk to you about.
Coconut oil. Coconut oil is the best tissue conditioner. Also, it's an antifungal, antibacterial, and antiviral. So you can use it every single day. You can place it inside, on top, and it helps with BV. So enjoy your samples. Surprise! Bye, guys.